This story is talking about the National Association of Nigerian Nurses and Midwives, that they have given the Kano State Government a 15-day ultimatum to address their demands or face industrial action. The decision follows the government's failure to resolve ongoing issues despite multiple correspondences. Now, signed by the association's acting state secretary and PRO, Ahmed Shada, the notice warns that all nurses and midwives will withdraw services from clinical and training facilities across the state if their demands are unmet by October 16, 2024. Now, the key demands include a reviewed hazard allowance, harmonization of the scheme of service, and a 259% salary increase under the Conhess scale. Now, this ultimatum comes shortly after doctors in the state under the National Association of Government, General and Medical Dental Practitioners began an indefinite strike on October 1 over unmet agreements, and now they are preparing for theirs if their demands are not met after the ultimatum that have been given. I'd like to bring you in on this one first, Mufasa.
It's more or less like an unending phenomenon, when you go into an agreement, with such a very important body, as, healthcare workers. Yes. It is only fair and just that once agreements are reached, those agreements should be fulfilled. And if you reach an agreement with a body, even with an individual, you should be rest assured of consequences if you renege on that agreement, the terms and conditions. So for me, they didn't just wake up to begin to threaten strike. There are issues on the front burner that they have presented before Nigerians, of course, in Kano State, so that you can see the reasons why they want to embark on a strike. Okay. Like they popularly say that when purpose is unknown, abuse is inevitable. So we now know what are the issues. We've always complained that there is so much brain drain. Our health care workers are moving out of this country in droves. So you could imagine why, these are the issues. When you don't take proper care of your doctors and your nurses, and you have people, you have countries who are beckoning on them to come with the promise of a better working environment. What do you expect? So for me, I think it's not yet too late for the government of Kano State to do what is absolutely necessary. If you have an agreement with these people, try to fulfill the agreement so that you don't have a position where the people of Kano State will not have access to health care.
All right, Gochuku, let's bring you in on this story.
I think this is one of those things I've just said that makes this nation impracticable to live in, because when a nation or a government fails to prioritize the health of her citizens, I don't know what the government is doing, because when you talk about security, when you talk about welfare of the people and or whatnot, healthcare is paramount, because a man who is not healthy, you don't even have the strength to carry the gun. And it baffles me how workers, especially medical workers, are not respected in Nigeria, but if you go to other nations, they are all one of the frontline citizens and the workers, including the teachers. But in Nigeria, the reverse is the case.
Are there no other ways to address some of these issues? Why do we always want to resort to strike, knowing the consequences of such? Imagine these healthcare workers go on strike. Look at what happened the other time when their colleague was kidnapped, and then they started threatening strike and all of that. Look at what happened. People started imagining, in a case where healthcare workers are on strike, What happens to emergency cases? What happens to the patients, even who are already in the hospital at that time? So why do we always want to resort to strike? Are there no other ways to actually handle these issues?
That is why I just said what I said, that the government does not prioritize the welfare of those sensitive workers. Because as citizens in Rivers State have been caught on the crossfire, but in that address that the governor read, you find out that they will say those in essential duties. Who are those in essential duty? They are the media, the nurses. Even when COVID ran supreme around the world, those who are into even penitent shop owners find out that they are now important citizens because they were allowed freely to make their movements. So when you bring it to the welfare of the workers and the midwives in Nigeria, you find out the reason why the government do not prioritize them is because they do not value the life of their citizens. From the question you ask, you can see clearly if a government values the life of the citizens and values the welfare of the citizens, which should be paramount in leadership and governance, you will not be owing or even allowing doctors and nurses to go on strike, doing what they have already, what they represent.
Yes, back to the question now. Are there no other ways to handle these issues? Why do we always resort to strike?
No, see,
because it's not just this. It's not just the health workers.
The health workers,
every other sectors, they always look at strike. And right now, as I'm talking to you, we even have another story still around that.
Around strike.
Yes.
No, you see, we are the third world country, and the government only listens to the drums of a kind of industrial war, which is industrial action. Because when the government prioritizes its own welfare, the welfare of those who work around the corridors of power, you don't hear that the governor is owed, his SSAs and all political office holders have been owed. You don't see them agitating for their own welfare. But when it comes to the welfare, the peanut that they pay them here, I mean the civil servants in Nigeria, the health workers inclusive, you find out that they find it very difficult, but they're still in the same canoe. That you can't tell me that this money that they are owing them or this welfare improvement that they are asking for, they just started in the administration of Yusuf in less than 2 years in office. But it has been over time. Ganduje was there for 8 years. Kwankwaso was there for 8 years. And you see all those things that are happening are accumulation of agreements reached. Like the one you see about every time ASU is crying is this dates back to 2009. So this one is not accumulated. But you now ask yourself, why are the government not prioritizing the welfare of health workers? It's because they don't care about the citizens. That's the question. And for the workers, the only tool for their voices to be heard is going on strike. Even when they go on strike, what do they even gain? Because most of them have been, the leaders of these organizations has also mortgaged themselves to the government.
You just said that the only tool that they could use to air their views is strike. Do you agree?
Obviously, he has actually said the truth. I know, as somebody who has been a comrade, I know that in struggle is what we call the 3 C's of struggle. You consult, you consolidate, and then you confront. And confrontation usually comes last. So I want to believe that these people did not just wake up one morning to say that they are not going to report at their point of duty. You know, nobody would want to see a situation where instead of going to work, they have to stay in the house. But over the years, we have come to realize and see that the only language the government understands
in Nigeria,
the only language the government listens to is the confrontation, which is the industrial actions. And it's only after you've seen these workers decided to down tools, either they want to picket or they want to go on full-blown strike, that's where the governor now invites them to the negotiation table. In that case, they are even putting the cart before the horse. Because if you had wanted these things not to get to that extent, initial stage where there was room for consultations, where there was room for negotiations, you perhaps didn't see it, expedient to say, let us resolve this matter before it gets to the stage of confrontation. It's after you've heard, there's a strike and all of that, governors, okay, let's see how we can resolve this. And so, what he has said is the
What are better ways you think that some of these matters can be resolved other than putting the lives of a lot of people in danger?
I just told you that even those workers themselves, I do not think they will be happy seeing patients suffer because of the strike. But in the language of struggle, I just mentioned the 3 C's of struggle. If the government fails to adhere, if they fail to reason in the first 2 C's, which is consultation and consolidation, they have to push further to ensure that government listen to them. These are the ways. There's no other way, because you don't expect the workers to now begin to force themselves into the offices of the government to say you must. The only way they feel they can push the hands of government is to say we want to dance. Of course, people will suffer. And when people begin to suffer, Nigerians will agitate to say that, look at people are suffering in the hospitals. Government, you must listen to these health workers. Which I don't say anything wrong in that. It just mentioned of how other civilized society, how they take the welfare of health workers and so serious.
Yes.
It is their topmost priorities. Health workers and teachers. In fact, it's even part of their policies. That's why you hear of Obamacare and all of it. It is in fact they make it a policy statement. You don't come to campaign with roads and water, because these are the basic. You must. It is an entitlement.
Yes, what you are saying, so, the options that you have given is from the side of the people now. From the side of the people, if you want something done, these are the steps that they like to take, right? That which you have mentioned. But then from the side of the government now, how do they put an end to, having these people? Okay, how do we get to how do we get to enforce these things from the side of government, letting people do what they are supposed to do, and not letting it get to an extent where the people on the other side now will start carrying out strikes, going on strikes, and all of those things?
You see, the government. Is there? How do you separate the government from the people?
From your explanation, it sounded like you already did.
No. Now, the government draw in an ideal situation. Government are meant to draw inspiration from the people. That's why they say sovereignty resides with the people. Who are the people? The health workers are the people. And they have made demands. And the demands are not bogus demands. Are also issues that borders on quality welfare for the people. So the government cannot be bigger than the people, because without the people, you cannot get the government. And the people are saying that this is what we want, for us to have a better healthcare system. So the government cannot dictate to the people that this is what we must give to you. And it is not serving the people the kind of quality that they want to survive. So I'm coming. So now the health workers who are meant to take care of the people are saying that if these things are not put in place, the people will suffer. And the government are saying that we cannot provide these things. And the health workers are saying that for us to force the hands of government to give quality health care to the people is to embark on this strike.
Sometimes it's not even a case of the government saying they cannot provide these things. This is an agreement. So that's not even the government saying we can't provide this. It's coming.
Yes, can I come in?
Yes.
See, in every union they have their rules and regulations. They have within the constitution, whether it's a local or their affiliation with the international body, they have the rules of engagement. In that rules of engagement, like Mufasa have said, there are procedures. That's why before they go on strike, the union had to write to the government. There is a window of 21 days. What have the government been doing within that 21 days?
Exactly.
So you are here now, as you are Lady Jackson, as if you are now, you want to paint it as if the nurses and the doctors are within, it is not within their right to go on strike.
No, that's not true. That is the way you are perceiving
yes,
it. Yes,
that's the way I perceive it, because you ask, is there no other way?
No, hold on, I'm not painting.
That was your question. Is there no other way they could communicate?
Hold on, please. I'm not painting anything, right?
Okay.
I'm asking you questions.
Yes, in your question.
To have a balanced conversation.
Yes, in your question
so
now, you said, is there no other way?
Yeah, are there what other ways? That's the question.
The other way is that they have written to the government. I give you an example. When the people that organized the End Bad Governance protest, I stayed here and analyzed it. The one they said survivor, the one that was carried out 2 days ago, there was a window. Now, what did the government do within that window?
You have made that explanation in your previous analysis that no one doubted or no one knew.
I know, but
so
it is the same case here.
That is the answer to the question which you already gave.
Yes,
so let's move on.
There was already a window.
And that was why you made mention of the rules of engagement.
Yes, exactly. The rules of engagement.